What do you think the single most important thing we need to be doing right now as Americans and as a country is?
Well, the very first thing is the social isolation, so that the number of contacts outside your household is minimized. And, washing your hands, distancing as much as possible. Those are going to cause this exponential growth in the infection to both level off. Hopefully in the next month, we'll see that leveling off in most of the country. And then as we go another month after that, we need to get the numbers down pretty dramatically so that then we can look at what activities we start to open back up.
Do you think there should be a national policy?
Absolutely. As long as people are moving around within the country, we're all in this together. It's not likely we're going to partition the country into all sorts of separate pieces because things like food and electricity, there are essential functions where we still want people to be connected. So it'll help everyone get out of this more quickly and reduce the deaths and reduce the economic reduction if we implement these strong isolation measures on a countrywide basis.
But we obviously have some states taking different policies than others. Do you think we need leadership from the White House that we're not getting?
I think that the pressure by fellow governors, the executive branch, the experts should be very strong so that all 50 governors are seeing that they need to do this, or that there is a federal order about the social isolation. The sooner you start, the less cases you're going to have, and the sooner we can all go back to some level of normalcy.
Earlier this year, the Gates Foundation gave $100 million towards fighting this virus. What specifically is that money doing to help Americans right now?
Yeah, our foundation works a lot on diagnostics and vaccines and understanding how to make new vaccines, make them in large quantity. That's what we're doing all the time. That's caused us to understand about this pandemic risk and talk about it going back a long time. When this particular virus hit, we saw that getting the testing capacity up very rapidly would be very, very key. And so there's a number of companies we work with on that. I've done conference calls with the drug companies, talked with the diagnostic companies, to really get this response so that we can see what's going on. Testing is important, drugs to reduce the disease, so we created the therapeutics accelerator for that, and then we're working closely with the vaccine companies, and they're the ones, although it's probably 18 months or so, they're the ones that can really get things back to where we're not worried about large public gatherings.
You think it's 18 months at the soonest?
Well, if everything went perfectly, you could do somewhat better than that, but I wouldn't want to create an expectation for something quicker. We've got to make sure it's safe. We have to build up the manufacturing capacity. And our team, who's experts in vaccines, works with Dr. Fauci and his team, and I think we've got a very common message about the work that needs to be done there.
Where do you think money needs to go most critically first at this point in time?
Well, the critical supplies, the ventilators, the masks, the protective equipment, obviously that is the most urgent thing to help the healthcare personnel. The testing capacity, so that somebody knows within 24 hours, if they're at all symptomatic, we should get them a home test. 24 hours later, they should know for sure so that they can isolate themselves completely and not have that infection lead to many other infections. Over time, it's going to be building that for all the vaccine constructs, that there's 7 or more that look promising. We'll probably have to build factories in parallel with testing the safety and efficacy, knowing that only probably 2 of the vaccines will be the ones we go ahead with. So it's risky, but it's so important to get not just hundreds of millions, but literally billions of those vaccines, because this is a global problem. And although the US has got the most cases right now, as time goes on, the developing countries where isolation is more difficult and the health system is very weak, sadly, they're most likely to experience the most pain of all as this goes global.
You've been saying for a long time that we're not prioritizing testing. Who should be leading the way here?
Well, the federal government needs to set the priorities because we have a lot of people who are just worried who would like to get a test, and if we had infinite capacity, that would be great. And so as many as half of our tests are going to the people they shouldn't, and that's causing you to have to wait often 3 or 4 days, even if you're a healthcare worker, to get that result back. Those results should be coming back within 24 hours because we're appropriately prioritizing the contact tracing and those who are truly symptomatic as the ones that use up that testing capacity.
Back in 2015, you warned that we were not ready for the next epidemic. Why aren't we better prepared?
Well, in fact, very little investment was made into, for example, being able to ramp up diagnostic capacity very quickly. And so we could have done work from 2015 or even earlier to do that. Likewise, the ability to make the antiviral drugs, to make the antibodies, to make the vaccines. Our foundation and some other governments did work on some new vaccine platforms, which are the most promising that are being accelerated here during this epidemic. But sadly, because you can't estimate the risk, and it was something I was trying to talk about and thought we had some engagement on, but then actually the personnel in this area were cut back. So I think this time people understand that this is a trillions of dollars event. It's going to be hundreds of thousands of lives on a global basis. I think now people understand why those alarms were raised, and that for the next one we will be far more ready than we were for this one.
How concerned are you about the resiliency of the American economy?
Well, the economy is being hurt, and that's translated into uncertainty, people losing their jobs, businesses that are having a hard time financing their costs. It's great that Congress has acted. We probably will need to do more there. But with the economy, we can bring it back. There will be a point where we have the vaccine and we're going completely back to normal. And we'll go somewhat back to normal if we do the right things, not even that long from now. But the economy can return in a way that people who get sick and die cannot. And so we're having to prioritize this isolation to minimize the medical impact. And it's unprecedented. It's unnerving. The numbers will certainly be in the even larger. I think it was $4 trillion I put into my 2015 speech, and I thought, wow, that is a big number. But in fact, that's what I estimated. World Bank had done an estimate, but this is going to be much bigger than that.
Yeah. You've been in touch with leaders in Washington. Have you talked with the president about this?
I've not talked directly to the president. Our foundation is trying to be as helpful in a very constructive way as possible, and that's why I've talked to the head of the pharmaceutical companies. We've talked to a lot of the agencies, including CDC and NIH, about how we work together on the vaccine and the drugs. Our foundation works so much in these areas that we're pitching in to accelerate these solutions in a cooperative fashion. So immense dialogue, all being done on a digital basis.
So from what you see in terms of the response so far, have we got anything right? Is there any reason to be optimistic about the way we've responded to this epidemic?
Well, there are countries that responded very quickly. So Taiwan, realized very early on what needed to be done. South Korea ramped up their testing and did the prioritization, so you're getting those tests back quickly. China dropped the number of cases so dramatically that they are starting to open up. Now, you wouldn't say they're back to normal,
right?
But they, that's a very good sign that if you take strong measures, which we're not as strong on a countrywide basis as they are. But the fact that now they can have the factories run, have kids going back to school, that's kind of a model and very hopeful. Even in parts of the United States, we're starting to see, and certainly by the end of the month, I expect we'll see that the regions that shut down and did it best, the numbers will have plateaued, and that's what you see before they start to come down. So, we understand what needs to be done here. It's going to be very painful, but taking the pain early means there's a lot less pain, both medically and economically, than if we dilly-dally and wait until every town has big numbers before we react.
Some people are somewhat suspicious of the numbers coming out of China. Do you trust the statistics coming out of China?
Oh, within 10 or 20%, the numbers about what's going on in the last few months, they wouldn't be opening up, they wouldn't be closing their hospitals. So clearly they turned the tide. In the early stage, they could have reacted faster up until in January, late January, they took those huge measures. But, people shouldn't let their views about a country, not let it inform them about, okay, what's really worked there? Why is it that they can go back to work and not see their hospitals fill up? So yes, they definitely turned the tide. We'll argue about the case definitions and the exact numbers for a long time out into the future. But it is the most important evidence here is the intervention they took went from an exponential increase to a decrease. Even if there's some uncertainty, it's a dramatic decrease.
You've called for something that you call germ games to prepare for the next pandemic. What exactly would that entail?
Well, the United States and other countries, but the United States most of all, spends like $600 billion a year to prepare for something that's uncertain, to prepare for a war. And it may not come, but you're willing to make that investment, and you make sure you have readiness by doing exercises where you try out different scenarios. So here, with a pandemic, which the chance over a 20-year period was always very high, and that's what I was trying to get people to focus on, you have to try out, can you make tests really quickly? How do you connect to the vaccine companies? What money could you give them in advance that would reduce the 18 months that we're having to deal with now? Understanding this, who should get these tests. So if you did a bunch of simulations, all of these issues would have been thought through, and you would have a game plan that you would activate, like the countries that, because of their SARS experience, did a very good job on the current epidemic. And so it will need to be, certainly tens of billions of dollars put into this readiness, these germ games like war games that will really test out our systems and make sure that we move faster than the virus does, which in the early stage here was not the case.
The last drill we had was, back in 2001?
Yeah, there was apparently, people are talking about, I'm not an expert on it, the Obama administration apparently decided to do some flu activity and look at that. I don't think that's been made public in terms of exactly what was figured out there. But the one that I do know about goes back to the 2001. It was called Dark Winter, and that was a smallpox simulation. Now, smallpox really is horrific because it's an over 30% death rate. In that case, the people who did it saw that, again, we were not prepared. The germ, in that case, would have won the war.
Why do you think we've been reluctant to do this kind of preparedness?
I'm not sure. Some countries and our foundation and Wellcome Trust did put money into CEPI, which is about vaccine platforms, to be ready for some new pathogen that comes along. So there have been modest investments, and of course, the general progress of science of how we do molecular testing, how we can build antibodies, all these things are advancing. And so, in fact, that's what gives you the scientific basis to be able to build pandemic tools that can be put to work very quickly. What people have to get in mind is that time is so important because you have this exponential growth. And in my 2015 talk, I show, in that case, another respiratory virus, a flu, spreading throughout the entire world, literally in a matter of a few months. And so the difference between early action, where you have the tools and you have the training, and then are waiting 2 or 3 months, that's a night and day difference.
Yeah. A significant portion of the $100 million that you're committing to fighting this virus goes to Africa, where they've not had a significant outbreak there yet. How concerned are you about Africa?
I'm very concerned about Africa and all the developing countries. As you say, the number of cases is not large yet. Now, that's partly because their capacity to test is very limited. The number of these PCR machines they have is far less than the United States, which actually has by far the most. And their ability to social distance is limited. It may be that the seasonality in the southern hemisphere is holding back infections, and so it'll start to accelerate in a few months. That would be good news for the northern hemisphere to have a period of 6 months of less force of infection. But unless there's some surprise thing that means the virus doesn't do well in those countries, they're likely in the end to have the greatest economic damage and the greatest number of deaths. And we should care about that as humans. We should also care because we need to get rid of this disease from the entire world to avoid the chance that you get reinfection coming back into countries who've already gotten it down to low levels.
As much as you looked at the potential of a pandemic occurring, is there anything that's really surprised you about what's happened in the case of the coronavirus?
I thought we would respond a bit faster. Even for me, who works in this area, though, the idea of what we're doing, how we're having to change the economy here in order to drop the number of cases, it's really unprecedented. And we're kind of in uncharted territory about how we minimize the pain. Even the issue of once you get the case numbers down, there's a lot of dialogue between our foundation experts and the government now, but what does opening up look like? Which activities like schools, have such benefit and can be done in a way that the risk of transmission is very low?
Yeah.
And which activities, like mass gatherings, may be, in a certain sense, more optional. And so until you're widely vaccinated, those may not come back at all.
So how long do you think this is going to last?
Well, I believe that by the end of the month, I hope we see the number of cases plateauing in the United States. The numbers will drive the actions we take. But for places that do the shutdown well, you should start to see that peak. Then, if you go another 4 weeks, those numbers will come down quite a bit if you maintain the measures, if you're not getting lax in those things. And then you can get it to a low enough level that the ability to test and trace contacts of the remaining people will be very, very high. And so some degree of opening up is possible. I've said 6 to 10 weeks, but again, every week as we look at those numbers, it'll help us see how much longer we'll have to be in this really extreme mode where we're not out and mixing around.
Yeah. So you're talking about midsummer probably at the earliest, where things are kind of feeling like normal again?
Well, I'd say for the places that started early, I do see that by the end of May, they could have very few cases. But it'll be tough if we have other parts of the country that we're still mixing with that have a lot of cases there. And so, lots of testing to get us those numbers so we can make these judgments well. Strong response throughout the country. Those are the two things that would tell us, hey, is May going to be the right time at the end of May? The seasonality of the virus, which we're still not sure about, nobody wants to promise that that's there to help us. That could, as we're getting into spring and summer, help reduce the number of infections that, for things like flu, other respiratory viruses are a big deal. And so the data is going to be key, and as we do the testing in the right way, that data will be very, very solid as a guide to what the next step is.
Mm-hmm. How do you prioritize who gets tested?
The key for testing is health workers, people who have essential jobs, contacts of people who are tested positive, or people who have the symptoms. People who are just worried and don't really have the symptoms, unfortunately, are a lot of the tests going on right now. Until we're super ramped up, that should not be using up the critical capacity, so we can get to under 24 hours the results to all of those very critical people. Some of them, we have machines, only a small part of our capacity that's even faster. So like the healthcare worker should be getting an answer in more like an hour with the quick turnaround machines. Today, many tests wait about 3 days, even the really urgent ones, and that's unacceptable.
You've not only studied pandemics, you've also run a major American company, which is, you have two credentials most people don't have together. What do you think the prognosis for the American economy is? How long do you think it will take for it to come back?
Well, the economy will come back. As we start to open up and are able to have people go back to almost all jobs, as the schools are resuming, you'll start to see that recovery. It will probably be years before you get back to where you were before because of the time, this is a big economic shock, and some things we really will want to be broadly vaccinated before we're not worried about this and it's changing our behavior in a significant way. So it is definitely the case it will take years to come back, but it can come back and it will come back.
What do you think the chance of another outbreak in the fall or the winter is?
Well, we'll understand the seasonality of the virus within a few months. That is, we'll see are the infection levels in the southern hemisphere going up. We'll see if the force of infection here goes down. And so it would be very good if this virus was seasonal, because the northern hemisphere, where most people live, it would buy us a 6-month period to really get our act together in terms of masks, diagnostics, protective equipment, understanding the drugs that can save lives here, and a lot of progress on the vaccine. So, we're all hoping that it's more like flu in its seasonality, even though, as you say, when the fall next comes, you better not have relaxed. You better be ready for that force of infection to go back up.
Is life ever going to be the same, do you think?
Not for some time. I mean, everybody who's lived through this will view this as a dramatic, scary part of their life, and it will affect, their concerns and how they look at things for the rest of time.
Should it ever be the same? Should life ever be the same?
Well, if we had been prepared, then it wouldn't have become this huge dramatic thing. And there will be, not a lot, but some countries like Taiwan that it appears, won't have to go through this kind of shutdown because they were so good at seeing the cases coming into the country and contact tracing and testing with really quick results what was going on there. After World War II, things were never the same. We dropped nuclear bombs. So the vigilance and the investment and using the best science to be ready for one, then there will be another one. We can't say when, but if you take a 20-year time period, it's a substantial risk. But the idea of big public gatherings, I do believe once we have the vaccination, then the kind of fears and the change of behavior around that, it could definitely be pretty close to where it was before this started.
Mm-hmm. Do you think we're going to think about pandemics differently from now on?
Well, that is for sure. There were a few movies, they weren't that popular about this, and to make them at least a little bit popular, they usually had some miracle happen at the end where some hero, invented something and boom, everything was back to normal. No, the awareness of this is a threat, and probably the biggest threat to kill tens of millions of people. That will be permanently embedded. So this time I do think we will get ourselves ready for the next pandemic.
Have you had any trouble getting adjusted to social distancing at home?
Yeah, I find it so disconcerting to wake up every morning and think, well, that was a strange dream I had, and then say, oh my God, yes, look, there's no traffic on the bridge, and oh yeah, my first meeting is on that computer screen, and my second meeting's on that computer screen, and and somebody's going to leave some food, but I won't see them. This is super dramatic. I use computer screens a lot, and I think about pandemics a lot, and even so, I can hardly believe we're in this situation.
Mm-hmm. It is. And every day it's different, isn't it?
And yeah, and we need to orchestrate the numbers, the science, the innovation, and we need to do it very, very quickly. And there are amazing health workers and scientists rising to the occasion here, and thank God for that.
One last question. Ultimately, did the federal government fail on being prepared for testing?
Well, I'm sure there'll be lots of postmortems about, why before this hit didn't we do more? Why, right when it hit, didn't we do more? Right now, I think it's most important to be looking forward and saying, are the number of tests growing? Is the speed which they come back less than 24 hours? And are we testing the right people? We're still not there, and so let's get that fixed, and then we can, maybe a year from now, do the deep postmortems.
Bill Gates, thanks very much for being with us. Please stay healthy.
Thank you.